Okay, so before I did any motion palpation, I would do all static palpations to look for edema or swelling, as well as any inspection to look for redness, scarring, lesions, or bruising within the area. The first thing that I'm going to demonstrate is how to find a PRS at C5. I would start that by contacting at the bottom of the cervical spine and having my patient flex and extend to make sure I'm on the right segment. I'm going to count up to C5, and I'm going to cover 2 to 3 spinuses just to see the motion above and below the segment that I'm analyzing. So I'm going to have the patient extend, and the spinuses should come closer together, and flex, and the spinuses should pull apart. If they don't, this would indicate fixation. I'm now going to do rotation. So the patient has a decrease of motion when turning to the right, or that could also be that the patient has increased rotation of the spinous to the right, and that would give me a PR. And lateral flexion, the patient would have a decrease in lateral flexion to the right, which would indicate open wedge on the same side, which would be a PRS. For a L3 PLI, I would motion to find L3. Can you cross your arms across your chest? And I'm going to bend you forward and lift you up. And just let me. Okay, I'm going to find my segment, cover 2 to 3 spinuses. I'm going to bring him through flexion and extension. And again, in extension, the spinuses should get closer together. In flexion, they should separate. I'm going to do rotation. Okay, if there is a decrease in motion with rotation to the left, then this would indicate that the spinous has moved more to the left, and this would indicate a PL. I'm now going to do lateral flexion. And if there was a decrease in lateral flexion to the right, then this would indicate that the laterality and the open wedge are on opposite sides, which would indicate a PLI. The next thing that I'm going to demonstrate is a PIEX for the ilium. So I'm going to have you come around the table. I'm still going to have you face that way, but I'm going to have you standing right here. Okay, and I'm going to find the PSIS and S2. Sit back a little bit. Sit back towards me. Just bring your whole body back towards me. There you go. And I'm going to have you bring this knee up like towards your chest. Okay? And the other leg. With the ipsilateral leg, I'm looking for the PSIS to drop inferior, and with contralateral leg, the S2 thumb should drop posterior and inferior. The same side, I'm going to go down to S4 and PIS and do the same thing again, this leg and the other leg. Okay, I'm going to come over to the left side, and I'm going to have you do this leg and this one. And then I'm going to go to S4 and PIIS and this leg and this leg. So if I found the right is fixated, and then this would let me know that this is where I need to look. Can you go face down on the table? I'm going to palpate above the SI joint, at the SI joint and below. For a PI, I would have edema above the right SI joint. The next thing I'm going to do is look at gluteal width. A narrow glute would indicate an IN, and a wider glute on the right would indicate my EX for a PIEX. can you stand up one more time for me and face the TV? Another thing that I could do to make sure that I have the right listing for the ilium is to check for gluteal folds. So I'm going to be contacting the back of your legs and moving up. Is that okay?
Yes.
Alright, so checking gluteal fold, edema around the SI joint, and motion palpation with the 8-point check is how I would analyze the pelvis.